Joining me now is Congressman Anthony Weiner of New York. Congressman, mixed messages, okay? We've got the Health and Human Services Director saying one thing. We've got the White House Communication Office saying one thing. We've got two different sound bites from President Obama. Hey, I'm on the team, but I want to be on the A team, not the B team or the C team. What's happening here?
Well, you and me both. I mean, look, most of President Obama's message has been right. I will be glad to follow him up this mountain because this is an important thing. We have to solve health care. The problem is I'm getting the distinct impression that the White House doesn't know for sure what it wants. I believe, and I think I've heard you say this too, we need a simple plan, a single payer for all. Medicare for all Americans, simple, easy to understand. But we have to have some form of public plan to provide competitive pressure on these pharmaceutical insurance companies. Right now, it sounds like what's coming out of the White House is if we just go the way we're going, the health insurance companies will wake up one day and say, okay, we'll hold down prices on our own. That ain't going to happen.
All right, let's talk, not to switch gears, there's a parallel here. Let's talk cap and trade. A lot of you guys over in the House did a very courageous thing with your votes on cap and trade, only to find out later there weren't enough votes in the Senate, okay? So I think that there's a real possibility that you're going to lose some seats in the House over that cap and trade thing because it is a tax increase. So here we are with health care. We got the House over there wanting a public option, but yet you've got Senator Conrad saying, well, we don't have the votes over here in the Senate. Are you guys going to stick your neck out again? And what good is it going to do, and what message does it send to the American people?
Well, you know, never mind the inside politics, which seems to be they think they can get a vote or two in the Senate and give up 100 votes in the House by doing the switch that happened today. Let's just look at the policy of it. You know, President Obama was right when he said all those weeks that the reason you need to fight so hard for a public plan is because if you have another private industry plan, they're going to keep rates going up and up and keep more and more people losing their insurance. But look, I think that what we need to make very clear, those of us who believe in national health care, believe in lowering our tax burden, is that President Obama, if he's not going to support a public plan, he's not probably going to get a bill. That's unfortunately the case.
Okay, if he doesn't, then he's flip-flopping. Okay, let's be very clear about that. If he backs off on public option, that's not the guy that liberals elected. And I can tell you from my radio show, there's a lot of people that are very upset. They feel like they're being thrown under the bus. A lot of people who supported this president to get elected now all of a sudden are saying, what the heck is going on here? You can't have reform unless you have a public option. You can't challenge the insurance industry unless you have a government-run plan. And now we're kicking around this thing about co-ops. The Senate's not going to go with a public option. How would a co-op fly with you?
Well, a co-op wouldn't achieve anything. It'd be a very nice idea that if we all wanted to get together as citizens and negotiate for lower prices, but we could have done that yesterday. Look, that's not going to happen. I mean, the public plan is so important to those of us who care about health care reform because it's not perfect, but at least it's something. And I think today you saw the White House backing away from their backing away. The important message here is that if the American people believe that the health insurance companies are getting too much in profits and overhead and they need competition, they're not going to get it with a co-op. They will get it with a public plan.
Backing away from backing away. Folks, let me tell you something. One person that is not backing away, and that is Nancy Pelosi. With tremendous clarity, she is out there with a statement today about the public option. There's going to be a public option coming out of the House. We agree with the president that a public option will keep insurance companies honest and increase competition. A public option is the best option to lower costs, improve quality of health care, and ensure choice of expanded coverage. Now, okay, we know where the speaker is, but the Senate. And the Senate has to have their arm twisted by the president. Why isn't President Obama playing hardball with the Senate Finance Committee?
You know, and I have the greatest respect for the president and for my friend Rahm Emanuel. You know, they're trying to get a bipartisan deal. Bipartisanship is a means, not an end. You know, they used to say that the Senate was the cooling saucer of our democracy. Well, they're going to be the icebox before this is done because we're not going to get anything. I think we as Democrats who are elected to lead, that's what we should be doing in this case. We can't wait for some Republican to wake up. And I have to tell you, with all of this negotiating that's going on, I don't see any Republican standing up saying, okay, now I'll support it. Right now, the White House is making concessions. I don't even know who we're making a deal with at this point.
Congressman, good to have you on with us tonight.
My pleasure.
Thanks so much. For more